Hi, I'm Dr. Cozy. It's nice to meet you. You found our clinic okay? Good. So I did get your paperwork sent over from your GP. Says you were referred here for dizziness, loss of balance. Superficial ear exam was negative. You do have a history of sinusitis, but you're not experiencing sinus pressure or pain at this time. And that's still accurate. Okay. Let me just take a look here at your chart, just to take a peek at your history. How long has this been going on? Okay. Have you taken any medications to try and alleviate the symptoms? Has it helped? Sorry. We will take a thorough look at you and see if we can't figure out what's going on. Okay, so in your paperwork it says you're experiencing dizziness. Are you experiencing that right now? Do you feel unbalanced at all? A little? Okay. What I'd like to do to start is just get a little closer to you. And I'd like to turn your head while I watch your eyes very closely. I'm looking for something called nystagmus, which is sort of eye movement related to a loss of balance. So that way I can kind of get an idea to begin with what to look for. Is that okay with you? Okay. Very lightly. It's not going to be any kind of big movement. Just watching your eyes. You're doing great. You feeling okay after that? Okay. Yeah, I do see some flickering in your eyes. You feeling dizzy right now? I'm sorry. It's important though. That way we can get an idea of what's going on. So real quick. Just turn on my light. Okay. Just had to take a peek inside your mouth at your throat, if that's okay. Okay. So it's just gonna press down your tongue so I have a better view. I have my little scope light here. Okay. See that you still have both of your tonsils. They look okay. I don't see any tonsillar inflammation. Everything's a nice pink. I don't see any pallor or redness to indicate irritation. bit of redness actually in the back of the throat. I don't see any drainage. You been experiencing a scratchy throat at all? Not that you're aware of, okay. There we go. Okay. Just gonna take a quick peek inside of your nostrils, okay? So, just gonna slide this in. Okay. Not seeing any drainage, so that's good. Take a quick look inside your ears as well. Okay. Let's get actually just a little closer here. Okay. Is there any tenderness when I place the otoscope inside of your ear? Okay. So, okay. Do you see a little bit of wax in here? It does look like normal cerumen, but I might need to clean some of this out to get a better visual. I can see the tympanic membrane, but I can't quite get it clear enough for you to see whether or not it's vibrating appropriately. The other side. Just, there we go. Alright. Is this side okay too? Okay. I'm seeing a bit of wax on this side as well. I don't see any redness or inflammation. Okay. So, okay. I'd like to clean out a little bit of that superficial wax, just so that way I can get a better visual of what's going on, right? So, it's not going to be a full-on ear cleaning. I'm just going to be superficially sweeping out any of that wax that's blocking my view. Just with this little curette right here. It's not going to be painful. Might be a little tickly though. Okay. Actually, let me grab something to clean my instrument off here. Let's place that here for now. So at any point this feels uncomfortable or you start feeling extremely dizzy, anything like that, let me know and we'll stop, okay? Okay. So just looking. the other side. Take a look again. Okay. Much clearer view here. Might be a little bit of redness around the tympanic membrane. Let's look at the other side. Seeing the same thing on this side as well. Okay. Alright. Just take a quick note here. So, now that I've cleaned out your ears a little bit, I am going to be turning your head again, if that's okay. Just want to see if that gave us any kind of improvement. Yeah, I'm still seeing the flickering. You feeling dizzy now? Okay. Well, because I can't really see a clear visual of the eardrum, but I can tell that there's some redness, at least on the right side, I'm going to do something called a caloric stimulation test, okay? So what that means is I'm going to be placing just a few drops of water in each ear, okay? And what that's going to do is stimulate the muscles that are deep inside the inner ear, which is going to create a sensation of you moving. These muscles are what detect movement, and if they're being activated when you're not moving, it can indicate an issue with the eardrum itself. It may be a perforation, although you said you're not experiencing pain, but sometimes we don't feel things. Could also be indicative of there being fluid around the eardrum that I'm just not able to get a visual of with my otoscope. Okay? It's not painful. It might be a little bit tickly or tingly, but it's not going to hurt. Okay? If there is any discomfort, I want you to let me know right away, though. Alright? Okay. So, draw up a little bit of water in a syringe. Sometimes these stoppers stick. That is enough. So I'm going to place this up by your cheek so that way that water drips down your face. Taking a look at your eyes. Okay. Let's do the other side. So let me just turn your head again because I do see the eye flickering. I want to see if there's an increase when we turn your head here. Yeah. Okay. Alright. So, okay. How are you feeling right now? Is there an increase in the dizziness? Yeah. Okay. Well, that is a good clue for us. So now what I'd like to do is another exam with the otoscope, except for this time I'm going to be attaching a little bulb. And when I squeeze that bulb, it's going to be emitting a puff of air into your ear while I'm watching. And the reason we're doing this is because I want to see whether or not the eardrum is able to move freely. So if it's vibrating correctly, then that gives us an idea of the mobility of the eardrum itself. If it's not able to vibrate correctly, it could be indicative, like I said, of a perforation or fluid around the ear. So this way we can know for sure. Okay? If I'm not able to see clearly what's happening, then I'm going to need to refer you to an audiologist so that way we can come up with a differential diagnosis and narrow down what's actually happening. But first, let's try this. So, I'm just going to attach my bulb to the otoscope. Oops. There we go. So, alright. Let me know if you feel any kind of discomfort from this, okay? Okay. So, placing this in the ear. Feel a little puff. Okay. Try that again. Any discomfort when I do this? Just let me know if that changes. Seeing a little bit of diminished mobility on this side. Okay. Let's take a look at the other side as well. Okay. So now for the right side. That's okay. It's not painful. Okay. How are you feeling after that? So, okay. One more quick exam. I'm just going to be using a little camera probe, okay? And it does have a little pointy end just to be used as a scoop in case there's any kind of cerumen blocking my vision, but I'm not going to be using that since we already cleaned out the ear. So I'm just going to be using it to take a little bit of a closer peek, okay? So, one moment, let me just start my computer back here so I can see the screen. Start. Oops. Left ear, okay? So, just positioning this to be able to see around the eardrum. Okay. Okay. I'm seeing a little bit of fluid on that side. So let's check the other ear. Okay. This side is definitely clear to see, and there is some fluid around the tympanic membrane. Okay. So, okay. Because I am seeing fluid in the inner ear, it indicates an inner ear infection, which would definitely explain your symptoms, particularly the vertigo. So what I'm going to do is write you a couple of prescriptions here. Okay. So let me just take a look at your chart. See what medications you've used in the past. Okay, so this says that you don't have any medication allergies, correct? Okay. Just making sure that none have been discovered in the meantime. Okay. I don't see any medications on your list that would cause interactions. So I'm going to prescribe 2 medications. The first one is diazepam, extremely low dose. but that's going to help with the sensation of vertigo. It's going to help you feel a little less dizzy, all right? I'm also going to prescribe you a Medrol dose pack. So that is methylprednisone. It is a 7-day pack and it tapers down, okay? It's important that while you take this, you avoid other anti-inflammatories, so no ibuprofen at this time, alright? But it's going to help reduce the swelling and hopefully alleviate some of the pain and pressure. If after a week you are not experiencing any kind of alleviation of your symptoms, you're still feeling dizzy, you're still feeling pressure, I want you to come back in and we'll reevaluate. And also at that point, I will be referring you to an audiologist so that way we can work together to figure out what's going on, okay? So, as in your paperwork, your pharmacy is the CVS on 16th. That's still accurate? Because the diazepam can make you feel a little bit loopy, sleepy, it's really important that when you take this, you're not going to be driving, operating any heavy machinery, anything like that, okay? Alright. So we'll get that called in, and then, like I said, I want you to return to clinic in 7 days, so that way we can reevaluate, make sure that you're doing better, and if not, we can come up with the next step in your treatment, okay? Okay. Do you have any questions for me before I step out? If you are experiencing breakthrough pain, even with the methylprednisone, I want you to give me a call, okay? And then we can evaluate over the phone and figure out a course of action to help alleviate the pain, okay? Okay. So, just re-sanitize my hands. Do you have any other questions? Yeah, so just stop at the front desk. Part of it is check-in and the other part is scheduling, so they'll be able to get you an appointment. And I will go and speak to them and make sure that they fit you in the next week, okay? We do fill it pretty quickly, but I'll make sure that they reserve a spot. Okay. Well, it was really nice to meet you. I really hope those medications help. But again, if not, we'll figure it out,